Intelligent and industrious, highly skilled in medicine and technology, with a creative, innovative and visionary idea and an unorthodox way of thinking, able to set priorities, identify partners and bring to life their groundbreaking concepts and solutions that fight diseases and improve human happiness and well-being. Healthcare hackers for the greater good. Do you want to become one? EIT Health InnoStars presents real healthcare hackers, the winners of the EIT Health RAS Innovation Calls for 2019 and 2020. In this podcast series, they share their experiences, the opportunities they identified, and the challenges they had to overcome. Listen in.
Hello, everyone. This is a new episode of Healthcare Hackers. My name is Andrew Wrobel, and I'm your host. And today I am speaking with another healthcare hacker. This time it's Alan Mutka from Croatia. Alan is a senior lecturer and research associate at Rochester Insitute of Technology in Croatia. And more importantly, he's one of the founders and the chief technology officer at Cognitus Limited. Alan, welcome to Healthcare Hackers.
Hello, Andrew, and thank you for inviting us to the Healthcare Hackers podcast.
Excellent. So let's start with the health issue you guys at Cognitus Limited have identified.
So we were working on a problem about leg-length discrepancy, which is shorter LLD, which is an orthopedic condition observed as a difference in leg length between the lower extremities. So this is a very significant medical problem, and the causes can be various. For example, some kind of traumas, diseases, deformities in the locomotion system. For example, surgery. If you go to surgery for a hip surgery, for sure you will get some kind of LLD, or if you have some kind of growth disorders, neurological illnesses, and unfortunately many other sources. Statistics have shown that significant percentage of the population suffers from LLD. And when we have started this research, we have of course started also investigating the papers. And in the last decades, a lot of research shows different number. So if you think how many people are affected by LLD, so we have found figured some kind of consensus that 70% of general population have some kind of mean discrepancy around 5.2 millimeters. And our research and initial tests have shown that this 5.2 is not something that we can just say, oh, it's fine. So it's not fine, and we have shown that, and based on that, we got some kind of money or funds to start with this research. So this problem usually appears first in childhood and influences the development of a child and creates severe public health problems at later age. So if one leg is shorter, that causes pelvic obliquity in the frontal plane and lumbar scoliosis with convexity towards the shorter extremity. So what will happen to the patient over time? You will have bad posture, low back pain. In general, the patient will have problem in walking and running. So generally, the question is how we identified it. So within Cognitus company, we have 3 co-founders, 1 doctor, medical doctor, Karlo Brovac, 2 engineers, Josip Nižetić and me. And for many years, we have developing some kind of CAD/CAM solution for custom foot orthotics, insole production. And also we are collaborating with several orthopedics companies and medical doctors. So in our core team, as I said, we have a medical doctor, and he identified or he emphasized that LLD problem through his medical practice. So because he has 20 plus years experience in foot insole production and several 10 and more thousands of patients. And what he does is when he detects the LLD, he measures the height, tries to get this height. And if one leg is shorter, then what he does is just increase the size of the insole. And then you put that insole in your shoe, and then in that way you just level the size. In general, how big is this problem? So as we said, it affects 70% of the general population with mean 5.2. But one of the biggest problem is there is no consensus regarding if this LLD is considered significant to treat. So their range is between 3 and 20 millimeters. So one say, okay, everything below 20 is fine. But that's also one of the major problems that we had in our project. So how you currently measure this LLD? So you have a clinical methods. which are simple tape measuring standing on a block, which have half centimeters precision. It's not possible to measure that. And you have imaging methods. For example, the best one is CT. But if you measure with CT, you have radiation, so it's not possible. So this is all the problem that we identified at the beginning, and we figure out that something has to be done to solve this kind of problem.
So you have already started talking about the solution. Tell us how the patients will benefit from it.
So as I said, our practitioner, or Carlo, works with patients, and what he has a 2 bathroom scales positioned next to another. You can imagine that. And then when if the patient is healthy and if he stands on that scales, then the values on the left and right scales will be approximately the same. So if you're a healthy person, if you're standing up still, if you're symmetric, you can imagine that they will be pointing the same value. But if there are some kind of problems, and one of them is LLD, then these differences will be shown. And this is our main idea. So we have these 2 scales. Let's try to lift them up. Let's try to lift them one up and one down. Let's try to tilt them. And somehow, what is the goal is to measure that the weight on the left and the right side will be the same. So the whole point is that we are trying to equalize the center of mass. And the whole idea is that we are not measuring the length of the leg. So we are not just using some kind of imaging techniques to get that distance. So our idea was, let's observe the center of mass of the body. And if you manage to somehow to set these heights and pronation, supination of these plates, and if you somehow manage to do that, then at the end you will balance the body. And you will get that information about the differences in the height. Maybe that difference is not exactly the difference in your length, but it is something that will, at the end, produce balance to your body. So you will be balanced at the end. So what we did is we did one big machine. And that machine contains of 2 plates that can be lifted up and down and rotated. And they have also on these plates, you have weights. So you can force sensors. And you have one algorithm, which is trying to change the height and rotation of these plates. And once these numbers are in balance, the algorithm stops. So that was the beginning. Later, we saw that this is not all what is needed. And then later, we also include the visual feedback. So you need to observe the body. Are you standing upright or not? So that was the idea and the solution.
There is one very interesting point that you made, and I would like to follow up on it. So you are saying that there is no consensus about the leg length discrepancy that actually becomes detrimental to our posture or simply causes other health issues. Is that right?
I think we are still in process on finding this consensus. And even we were through this, when we were inside the project, we were working on a project, we have a mentor, and this mentor was going around and also trying to get this consensus, what is really relevant, what is not. And I don't think this problem is open enough. And I don't think there really needs to be more discussed. And because of that, we have problems not only with, we had problems and have problems, not only in general consensus in medicine field, but also with funding. But nobody will give you funding if something is not really clear, if you really need to solve this 2 centimeters LLD or not. But what we have when we were applying to our project, we have project partners, which are 3 private companies, and 2 private companies and 1 public institution. So through these private companies, one of them is Pentathlon, it's an orthotics laboratory. They were focused more on foot orthotics. The other one is a Croatian special hospital for orthopedic surgery. Through them, we are trying to go towards the patients through the application of surgery, especially hip surgery. And the last one is the University of Rehabilitation Institution in Socha, which is one of the major institutions in the region. And there we are working more towards rehabilitation. So and they were also partners on our project. And since we have developed 3 machines, and they are in all of these places, our goal is through this testing phase and evaluation phase to get the results in all these fields and later publish journals. And then in that way, first we need to change the whole public opinion about it. And hopefully then we can go forward.
Yes, identifying partners is extremely important when validating solutions. Also, you have started talking about challenges that you have faced as a startup. And earlier, you also mentioned the hardware that you build. Hardware is a challenge in itself, isn't it?
Yeah. So when we started our project, the most funds that we needed to our project is create this machine. So if you think of that, this machine needs to carry or weigh 200 plus kilogram person. So, and what we got is that we got one machine which has 130 kilogram of aluminum, which is really heavy and expensive. And the most of money went to hardware. And what is the great challenge when you're doing any kind of project with hardware, you cannot undo things like in software. So I can maybe make major changes later because I will just take 1 week and I will not sleep and I will finish that in software. But in hardware, you don't have additional 30,000 euros to build another machine just because you thought that something is good or not. And this is really challenging, especially in this project with this hardware part. Yeah.
I understand diagnosing leg length discrepancies takes time. How could you shorten this time and be able to offer insoles, faster?
We have, of course, so in any project, so we have a lot of hardware, but we have also a lot of software. So when we are trying to go to the market, we have, of course, problem how to put this hardware on the market, especially if although licensing, certification, class 1 medical device and similar. So our idea is first to introduce first to get some kind of test results or numbers we need to get from the patients, and then maybe create some kind of software or some kind of app on the cell phone. And through that app, we can introduce the problem, and through that app, we can generate some initial revenue and start with that problem. Because you have, even if you check, you have some kind of application in that field, but they don't tackle so much in the details, so it's not focused enough as we want it to be. So this is one way, maybe how we can introduce that to the people, and then once that application will tell them, okay, it's maybe you have some kind of problem, and not exactly what is the problem, and then they will maybe come to us, and then we will measure them, and this is some kind of process that we are trying to set up.
I need to ask you about COVID. How has the pandemic affected you?
So we have, let's say, two sides. Of course, when we finish the project, when you have a hardware, software, the project is done, but it's raw. You always need to polish something. And then since we needed to transfer this platform to Slovenia, then as COVID started, we had problems with communication going there. But also later, of course, you need patience. And patience, because of the COVID lockdown, could not come. But there is another side that we got more time to polish the system. And, I can see the two sides. So on the one side, of course, it stopped us just working with the patient, but the other side enables us to improve more system. And so to reduce stress in the later implementation, let's say it like that.
Yeah, I like the positive aspect. Now, at some point you mentioned financing. How did you manage to get funding?
So first we started with local fundings. So we get 30,000 euros in Hamak Bikro, which is Croatian agency for SMI. So we had no proof of concept, and we wrote that proposal, and we got fundings to build it. That was our first step. And then later, based on that, since EIT Healthcare requires some kind of proof of concept, we had really good start. So we have journal papers, we had a patent, we had all of these materials which have proven that we have something as a proof of concept, and that was a good start, and we got the innovation award in 2019. Yeah, that was the process.
So the proof of concept is vital if you want to get substantial funding, right?
It is. So I think that you need to prove to others that your idea, that you really want to implement that. So this first part, that we got 30,000 euros, but 30% of that amount we need to pay from our side. So it's not like in EIT that you get 100% of money back. So in that way, we show that we really believe in our idea, and that we are not only investing the time, that we are also investing our money, our resources, other resources than time. And I figured out that this is what they like, especially in EIT. They require you to show the level, the proof of concept, if you have some kind of proof of concept, the level of your project.
Would you have any other tips for startups that have an idea and are looking for funding?
I think you need to have a good team, multidisciplinary team, and have a good idea. And first you need to discuss it internally. And then with that idea, you can go out and you can create some kind of proof of concept at the beginning, but don't invest a lot of time and money in that. Try to communicate with others. Try to figure out if someone is willing to pay something for that. If it is, and then maybe you can continue forward, especially if you have some kind of hardware. This is for my opinion. At this point, I think you can get funded. You can get funds really easy for any kind of idea. It just has to be at certain level. What we had problem before, it's that team is important. It's not just the engineers and medical specialists. There's also that economic side. You need to have someone to build that some kind of initial business plan, and to show you what are the revenues. But on the other side, who are evaluating, they're looking also on that side. So before we didn't have this kind of team, we were not successful. So all pieces needs to be there, and then you need to invest your time and to write a proposal, to polish it, and then you will see some kind of results. These are for my experience in this field.
So finally, what are your plans for the next 12 months?
For financing, this is not our primary project. So we are still doing this research inside the clinics, and we need to get the results and then publish the research. And then based on this research, we will get results and go to get more fundings. So first we need to reduce the hardware, remove it completely, and we need to be able to send this technology towards the people in the faster way. So 130 kilos of machine is not an easy way to move it from one location to another. So we need to find something different to approach, maybe to start testing on the children. So in the schools, so that was our idea. So they have the biggest problem. We need to detect this problem at early stage with children, and then maybe through this kind of research to continue to widen the research. So that's our general plan, what we have.
Alan, thanks a lot for sharing your insights with us. I really appreciate it. And good luck with the project.
Also, thank you, Andrew, again.
This was Healthcare Hackers. Stay tuned to the next episode, subscribe to the podcast, and leave a review. And don't forget to check out our EIT Health InnoStars website for more info about the EIT Health RIS Innovation Calls and other opportunities and stories.